Hello, I want to talk to you about a patient that came into the ER today. He was a 72-year-old male who came to the ER at 10 p.m. He came in complaining of pain to his left side. He also said that he had an urge to urinate, but very little came out. When the patient came in, I performed the focus assessment of the genitourinary system, which includes the kidneys, bladder, and reproductive organs. I asked the patient about his flank pain. He described the pain as a dull pain that radiates to his left groin. It is an 8 out of 10. I asked him if he has had a history of kidney disease and if he has ever felt this way before. He says he does not have a history of kidney disease and has never felt this way before. He also expresses concern about not urinating much. I asked him about his urination patterns, and he told me that he has been feeling like he has had to urinate all day, but only dribbles have come out. He states there is a burning sensation when he does pee. I obtained vital signs. He has a temperature of 101.4. He was tachycardic at 114, had a blood pressure of 152/88, SpO2 is 96 on room air, respirations of 22. I performed a bladder scan and it showed me that the bladder was full. I also performed an ultrasound scan of the kidneys and it showed me that it was swollen. I also obtained blood work for his creatinine and BUN levels, and they were elevated. One of the first treatments that I did for this patient was I catheterized him using a stylet to relieve the urine from the bladder. In order to fix the problem further, I can administer medications such as alpha-adrenergic blockers and 5-alpha reductase inhibitors. This would relax the muscles of the bladder, neck, and prostate. There are other medications I could give as well, such as anti-androgen agents or dietary supplements. But for this patient, I believe the only way he will improve is if he went through transurethral microwave thermotherapy or even more advanced therapy as a transurethral resection of the prostate. Also, for this patient, due to the fever, I was concerned the patient has an infection. The infection needed to be treated quick with antibiotics before the patient became septic, so I administered a Cipro to this patient.